warm hello to all of our update viewers. I am Annika and I'm quite excited to announce that we are having our first in-person interview since the pandemic started. And speaking of the pandemic, I am joined by Dr. David Nabarro from the WHO. He's a special envoy for the Covid-19 pandemic. Dr. Nabarro, welcome.
Hello, and thank you. Lovely to be here, Annika.
So you became a physician in '73 and then became a lecturer in tropical medicine schools. And then later you worked also close to the UN's General Secretary on the 2030 Agenda for Sustainable Development and Climate Change. And now you are one of the 7 WHO special envoys for COVID-19. What inspired you to delve into such a career?
I think when I started, Annika, I always felt things should work better in our world. I couldn't understand why there was so much inequity and so much damage to our planet when we have plenty of science to remind us of what this is doing, and we have governments staffed by skillful people who know how to manage to deal with complex challenges. And perhaps naively, I thought, that's not working as I believe it should be. I'd like to have a career in international public health. And that meant that soon after I qualified in medicine, I was really eager to go and work in different places and to see healthcare under different circumstances. And then after about 5 years, there was no turning back. That's how I've stayed in global public health issues.
Yeah, I guess the things just followed and you followed that path.
It clicks, doesn't it? You start moving into a new area and you think, is this really for me? And then after a bit I found I could really enjoy it, and I think I could be useful. 2 things: I love learning and then teaching, and I think life is about continuous improvement through learning. And secondly, I've never believed that any problem has a simple solution. I've always believed that problems are interconnected and solutions have to be matched to those interconnections. Otherwise, you think you've got a nice clean solution to a problem and whoops, you find that other unexpected outcomes have occurred. So that means 2 things. One is obviously I've become, in that second point, a systems thinker. And secondly, I really am committed to working with all people everywhere on finding solutions to these global challenges.
Hence the needed collaboration between people and nations.
Do you know, if humans work together, they can achieve miracles. If they work isolated, they can only be quite limited, and particularly if they work with others that they don't agree with, that's when the amazing results happen.
And pandemics are actually not new to human society. And when you were appointed as special envoy for the UN Secretary General dealing with the Ebola outbreak, what solutions there did you observe that could be useful today with COVID-19?
When I was working on Ebola in West Africa, I found a real anxiety, because this was an outbreak like nobody had ever experienced before. Ebola had come into the towns and cities of West Africa, and it was leading to quite a lot of death, sudden death, very public. And certainly when I started working in Liberia in 2014, this was a country, and indeed a government, that was really very scared. First thing I noticed was, you need friends. And when President Obama rang up the President of Liberia in mid-August and said, "Mama, we are with you," it had a huge impact. And probably that was a big turning point. Secondly, the President said, we, the people, will deal with this Ebola outbreak. We will learn how to do it, and we will do it together. And it was she who showed me that working with the people gets you the best possible solution. If you have a situation where the state is somehow in conflict with the people, even perhaps sometimes with the military being used. When you're dealing with a disease, things get difficult. So a partnership with the people was key.
And this actually, what you're mentioning, makes me think of an interview we had here a couple of days ago with Dr. Jenny Cole.
Yes.
And she was talking about how, in her view, during this pandemic, scientists worked well together in trying to stop the spread, but however, politicians or political parties really haven't really done that. What do you reckon governments should have done better? Because we're still into this pandemic, and I remember back when we thought it was going to end in just 1 year.
So we're still in this pandemic, and yes, I'm sure that we can all do better. I am nervous about judging too much at this time because we just don't know how it's going to evolve. But my one basic view is this. This virus is not very lethal. It kills a proportion of the people it infects. It particularly tends to kill older people. And yet, to get control over the virus, governments are requiring the response of the whole of society. And there are just some sensations that there are people who say, why should all the young have to make sacrifices to benefit what will be the very old? Can't we really look at it differently? And there's been a lot of ethical debate about policy, and I think that's what's led to the politicisation of the responses in some cases, because in a funny way it is turning out that the ethics themselves have got polarised in politics. For example, if I'm in southern USA in certain states and I choose to wear a mask in public, that can be perceived by some as a political statement. And that's made, frankly, responding to COVID much more difficult than anything I've ever done before. Is just the degree to which there is polarisation on the political spectrum about some of the actions that I believe need to be taken. That's the tough one.
And linking to that, the Director General for the WHO during the Economical and Social Council of the 2021 session, he said, vaccine equity is the challenge of our time and we are failing. And at the time, only 0.2 of the more than 800 million vaccine doses that were administered
in poor countries.
Were given to poor countries. What do international organizations or what should they do, and as well as nations, in really to get that collaboration going? It is quite a challenge here.
It's a huge struggle, and actually, I've never seen such a battle. I saw something like it when HIV/AIDS was raging at the end of the 80s in certain parts of the world, and it's more strongly now. And here's the challenge. This pandemic is affecting wealthy nations, middle-income nations, and poor nations. And the vaccine that we have is brilliant for saving lives of people who are at risk. The correct thing to do, looking at it totally rationally from a global perspective, is to spread that vaccine out amongst the people who are at risk. That's older people, people with diabetes and other diseases, and health workers, and make sure that wherever they live, they get vaccinated. Then afterwards, you go for vaccinating the rest of the population, including the young, and then afterwards you go for booster doses. Why hasn't that happened? Answer, because actually the wealthy nations are so badly affected that they want to do everything possible to get as much vaccine as possible in order to restart their economies. And they're putting that above the global picture. Will it change? I did think it would change, and it's not changing yet. But the thing that will really focus minds is if a variant appears that is capable of breaking through the protection offered by some or all of the current vaccines. I think that will switch minds. And secondly, I really do think that within the next months, that a number of the current generation of world leaders will just come to realise that simply focusing on your own nation is a thoroughly short-term and restricted position on what to do. I nearly said something even stronger, because I truly believe that the only way to deal with this is nations working together.
And speaking of vaccines and variants that are coming up, we know that if we're not really reaching a critical point of herd immunity, those variants can develop as the virus mutates. And there's a bit of a debate now also around that vaccine, because some people refuse to get vaccinated, and sometimes specifically towards the mRNA vaccine, as it's deemed to be too new technology.
Yes.
And as you said in your talk, and I heard also on the Swiss News Radio, that this technology is in fact not that new, and as it was developed, it has been worked on for several years, in case a new coronavirus outbreak would occur. So what would you say to people who are skeptical or maybe unsure about vaccines?
I think it's right that everybody's unsure about a new vaccine. Everybody's unsure about whether or not they feel happy to receive it. That's okay. And in each one of us, it's a balance of risks that we work out, and our perception of risks may change over time. My own did, particularly at the beginning of this year, and it's okay. I mean, the one thing I really do not wish to do is to, in any of the statements I make or positions I take, to imply that holding one or other point of view on COVID vaccination is a good thing or bad thing.
Right.
It's just a reality. And there are people in my family, my own, not quite flesh and blood, but who really do not want to receive this vaccine, and some of them are doing that as part of a more general concern about vaccine. And all I want to say is, let's respect it. Let's not work against it. Let's work with it. What tends to happen is people change their positions over time, both ways. And I just do not want, at least myself, to get associated with, in any way, forcing people to be vaccinated. Because I think once you start doing that, then the trust between government and people gets really stretched. And in the end, we don't want that trust to break, because we may have to, in any country, shift what we're doing if a more serious variant comes along, and we'll need to have trust between government and people. If it's broken, it'll be really hard to shift direction, and society's going to have to be agile in the face of this one.
And I guess it's also harder to trust the government if all the policies are centralized compared to broken down to maybe smaller parts. I mean, in Switzerland, for the COVID, we had some policies applied only specifically in cantons.
That's right, yeah.
And then, in the communes, it wasn't. They didn't have any say into this. Do you think it should have been done that way?
Well, I actually had quite a lot of discussions with colleagues about Switzerland. If you say policy can be adapted at the commune level in Switzerland, you're creating a very large number of options, and the real challenge for people as they move from one commune to the next.
True.
And you could actually end up with friction between communes. And so I think that it makes sense that in terms of decentralisation, there was some latitude given at the cantonal level.
Right.
So for me, that makes sense. But at the commune level, there are still things that are very important to be done. Particularly this business of maintaining surveillance over the population. In a soft way, it is not heavy surveillance, but just understanding what's going on, which is one of the beautiful features of the Swiss system. That the commune system is a very benign surveillance system in my judgment, and this is quite good for dealing with a public health challenge like this one.
It's true, it could be quite difficult. Like you're saying, you would have conflicts between the communes since they're quite small,
Exactly.
and you would just have people commuting.
And we have this, by the way, I want to stress that there's been quite a lot of border frictions between European countries.
Yeah, as well.
As we've moved through this. And my hope is that gradually things will settle down as there's a greater understanding of how best to manage the risks. The only difficulty is that this is also a continuously changing situation, so the settling is a bit slower than one might have hoped.
Yeah. And finally, for my last question, well, at the start of the pandemic, we were just hoping it would be like a year long or something, and we're still into this, and I guess it's not gonna go away. There was on the Swiss news, I also heard someone estimate that, well, it could be over by the next summer. But I feel slightly skeptical of that statement because the pandemic, well, the disease could very well be endemic and then remain in our population. How long do you think it take to go back to normal, or if there will be any normal?
Well, I think that it's best to behave as though this virus is here to stay. And that means here to stay forever.
Yeah.
Now, that doesn't mean that it stays with the same potency. In fact, the potency could change due to variants, and it can change due to other factors, such as the normal trend for viruses to reduce in terms of their unpleasantness over time that we see with influenza, for example. So, start from the assumption it's going to stay. Number two, recognise that doesn't mean we have to accept masses of death. Instead, it means we have to put in place the systems to protect ourselves. And to do that, we need strong, localised public health services, health of the population, taken together with a recognition that it's here to stay, and these population-based public health services, overseen by a global coordination, will be able to live with this virus, even though it's nasty and even though it goes on mutating. But if we don't manage to get these steps in place, then it's going to be, from time to time, quite tedious. And that's why I, for one, am working for global, unified approaches in the response to this. Even though it's horribly difficult in the current political context, that's what we need, that's what you need, that's what the world needs.
Yeah, collaboration really is the key, and we need to not fall into the trap of polarization and kind of screaming at each other. It's better to find some kind of common ground so that we can work forward.
Especially if it's polarization to win votes. Because this virus doesn't vote. This virus is apolitical, and we need to be a bit apolitical in responding.